I'm here with Natalia. She's a longstanding patient. She was first seen on 11/12/2008 and was last seen on 2/19 of 10. When she was first seen in the office, she had severe allergies, as she puts on her admittance form, allergies, 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 dash asthma. At this point, she says her allergies are 80% gone and her asthma is in remission. She has an occasional flare up, but she rates her asthma as being 75% improved, although I haven't seen her since 2/19 of 10. On her first visit of 11/12/08, we found that she had craniosacral subluxations, upper cervical subluxations. She was allergic to chloride, formaldehydes, heavy chemicals, food preservatives, food dyes, and food coloring. That was on 11/13/08. Within 5 days of starting on the detoxification program for those toxins, she'd stopped sneezing and felt she was 90% improved in her upper respiratory tract and sinuses. So today we're going to go through a reevaluation. I haven't seen her, like I said, since 2/19 of 2010, so it's been a little bit of time, and we're going to see what we find out. And be strong. Be strong. Left knee up. Resist me. Be strong. And be strong. Okay, and this is exactly what we found with her on her initial visit in 2008. She's called an all-weak syndrome, which means that there's so much interference with her autonomic nervous system, she can't generate enough energy or action potential in the nervous system to send the energy from her brain to her muscles. Shoulders are weak, hip flexors are weak. Turn around, Natalia. Lean against the table. Balance on the left leg. Bring your right leg up. And be strong. Testing her hamstrings. No strength at all. We're going to test her latissimus dorsi. Hold your arm in. I'm pulling straight out. And there's no strength in the lats either. You can turn around. So we need to find out what is this overwhelming stress that's causing her nervous system to be working at a less than optimum function. Now, when I first saw her in 2008, we found that the number one problem that she had then was cranial subluxation, which we're going to screen her for right now. There's several ways to screen for craniosacral subluxations, but I'm going to do the easiest one at this time. And let me have you do a normal inhale and be strong. Now force air in, real big, be strong. Now let air out, stop, be strong. Now blow the air out, be strong. Okay, so we're seeing that it's not a craniosacral subluxation because the inhale, force in, exhale, force out test, screening for craniosacral subluxation didn't change anything. So at this time, we're going to move on and see if there's something else that we can find that's causing her stress. We're testing these for fungus, mold, yeast, bacteria, virus, and parasites. That's what these test kits are for. And be strong. And that's not an issue with her. We're going to test her for environmental, industrial toxin. And that's not an issue. Now, you're working in a daycare center?
Yes.
Did you have all your vaccinations? Did you have to have them redone?
No.
No? Okay, good.
I did have a TB test, though.
Okay, hold this and be strong. Okay. Be strong. Be strong. Okay. Turn your face to the right. Be strong. Turn your face to the left. Be strong. Okay, when she turns her face right and left, she immediately goes strong. Now, I don't know if this is what's causing the all weak syndrome, but when she turns her face right and left and goes weak, or a strong muscle goes weak, or a weak muscle goes strong, that's indicative of a upper cervical subluxation at the base of her brainstem. So I'm going to take her down on the table right now, and I'm going to correct that. So we just saw that Natalia went strong when she turned her head right and left. That indicates an upper cervical subluxation at the brainstem involving the first cervical and the occiput. We put her down on the table and we're going to adjust the occiput to lift it up off the atlas. That usually clears the problem. When someone has so much stress at the base of the brainstem by a cervical and occipital subluxation, or we see that not only causes all the muscles to be weak, it also affects the immune system and makes her more prone to getting sick and getting an infection. This is an Impulse IQ. It's the only impulse tool I like. I've used the activator for 38 years, actually more than 38 years, $650, $4,000. The difference is this is computerized. First impulse senses the resistance of the bone to move. It then sets up the other impulses, and it stops adjusting when the bone starts to move. So we're going to come right in here with the prong, place it on the occiput, a little traction, and there we go. So we're going to bring her up and recheck her. So with Natalia's initial re-exam, we find that she was all weak syndrome caused by, I believe at this time, a cervical cranial subluxation at the C1 occiput level. We just took her down and adjusted her with the Impulse IQ. How was that adjustment? Pretty rough?
Not too bad.
Not too bad at all. And now we're going to recheck her to see what the response is. So we go back to her left arm, be strong. Now she's totally strong, be strong. Totally strong, left knee, be strong. Right knee, be strong. Face against the table. We had her hamstrings were bilaterally weak before. Balance on the left, hold this foot up, be strong. Strong, hold here, be strong. And we tested her left lat, and hold here and be strong. Back against the table. So one correction at the base of her brainstem, adjusting the occiput off of the atlas, as indicated by her strength returning when she turned her face left and right, results in taking care of the impingement of the brainstem, allowing the energy to flow to her body, which is represented by everything getting the energy it needs to contract, and she goes strong. So let's go back and recheck her, turning her face right and left. And turn right, be strong. She stays strong, turn left, be strong. As soon as she turns left, she goes weak again. So that tells me there's still a subluxation in her neck. It's on the right side of her neck, and it's below the occiput and first cervical, so it's second or third. So I'm going to palpate her neck, and sure enough, there it is, C3.
Yep.
So I'm going to adjust her standing up for ease of the camera. Let's have your face against the table. Normally I would lay the patient down, but it really doesn't matter. Although I do have a protocol for adjusting people in the position in which their body hurts, sitting, standing, at a workstation, laying down, whatnot. So we found that vertebrae was out on the right side. Good. Back against the table. Now we're going to retest her with her face turned to the left. Be strong. And she's now strong, which tells me that we corrected the third cervical, which is out of position, impinging the nerves in her neck.